There we go, now we're recording. So everything here will be recorded, which means if anyone wants this as a replay so you can check back at any point, just let me know at the end and I will obviously get that sent over to you. It will come over as a YouTube link rather than a whole file, because a whole file will be huge. Right then, and if you want to ask a question, you don't have to have video on. You can do it with just your microphone, or like I say, you can put it in the chat, no problem at all.
We've all gone off. We've all gone off air. Nobody wants to see us.
Just Pauline's ceiling, I think I can see. Which is fine. That's fine. I can turn mine off as well. No, I won't. I'll stick the duck in charge in a second. So, what are we talking about? I think most of the people on, if not everyone here, actually has an idea of who I am at least. But I've written out an intro, so I'm going to do it. So obviously I'm Jo Nutkins. I am a Kennel Club accredited dog trainer, but I'm also a certified professional canine fitness trainer. I'm certified in kinesiology taping. I have been continuing my training in canine massage and foundation Galen myopathy, and also have in the last few months been working through the canine arthritis management level 1 course. So all of these things put together, it really does highlight from where I'm standing when a dog is in pain, showing pain, what might cause it. You can certainly see something that a dog might be doing and you cringe because you think, yeah, that's going to cause problems later on. So really I wanted to just do this talk to try and help cover a few areas that could either help a dog that might be in pain now, it could help identify pain in the future, might be able to prevent some of it as well, or stop it from getting too bad too soon. Some of you may already know that Merlin next to me here has got both of his knees have luxating patella. He's had luxating patella diagnosed when he was 1 and he's just turned 9 in December. It was diagnosed purely because I took him to the vet and said to my vet, can you feel his knee please, because I think something's going on with his patella. The vet couldn't find it, it was so mild. I had to literally show the vet how to manipulate the leg to feel the movement and the clicking, and that's how then I could get a recommendation, a referral over to Hydro to kickstart his exercises. But if I didn't know what I was looking for, if I hadn't realised that the clicking he did when he was itching his ear wasn't right, then he possibly would have gone a couple more years before anything had been noticed, and by then it would have gone from grade 1 to grade 2 or 3 and more likely would have needed surgery. But because I noticed it nice and early, because I knew what the signs were, I could, just bring Judy in. I was able to start exercising him very early on from certain things. I was able to avoid certain things as well. And at 9 years old, he still hasn't needed any kind of surgery. He's absolutely fine. You wouldn't even know that he had anything wrong with his knees. Hello, Judy. So I'm just saying to everyone, you can keep your video off, no problem at all. If you want to write a question in the chat at any point, please do. I am filming this as well, so I'm just introducing myself, but you know who I am already, and just mentioning with Merlin and his rubbish knees, really. So you wouldn't know he had a problem with his knees, but I do certain work with him to keep the muscles nice and strong. I avoid certain things with him that I know are likely to flare up the knees. And as a result, the surgery that the vet told me he'd need in a couple of years when he was age 1, he's never needed it. And he never has a locked leg, he never has to skip, he never has anything wrong with his joints at all. But I do have to keep that management there. So this is the sort of thing I'm hoping to try and help people with, okay? So we're going to be looking at what might cause pain for dogs. We're going to, I can hear people talking in the background. If anyone needs me, just sort of talk a bit louder. Or if you're chatting, just to pop yourself on mute for me. And the duck's chatting now, so that's more distracting echo. Understanding different types of pain in dogs, so that there are more than one type of pain, and that can be why it's confusing for us owners to be told that our dog's in pain, but we can't see where the pain would be. How dogs communicate pain, so it is very different to how humans tend to do it. What? ducks chatting, and how we can prevent some of the more common causes of pain. And I'm going to put a bit of focus on canine osteoarthritis, because that is such a big reason that dogs have pain and discomfort. So, causes of pain. When we think about whether our dog might be in pain, there's often really obvious things that can go in. I'm just sorry, it's so funny, everyone's on no video, so I'm just getting people's names come up where people are talking in the background, or there's a noise in the background, so I'm just getting a name come up. It's quite funny. No face, just a name. It's almost like this person's talking in the background. So when we think of pain, we might think, okay, so a dog could maybe damage their leg. They might fall down something. They might get hit by, unfortunately by traffic. Injury-wise, loads of things could happen there. We might be thinking that a dog has been really, really ill and then needed something doing, and that could obviously then cause pain. So quite often pain in dogs is thought of as something really, really big and really, really obvious, when actually so many things can cause pain that are underlying, that are hidden, and that actually dogs don't respond to straight away at all. So we don't know there's pain there, but the dogs really, really do. So sometimes they can have pain from joint related issues. So as I mentioned, someone else is trying to come in. So as I mentioned before, joint related, like Merlin's patella. It could be the dogs that have got hip problems, knee problems, elbows, ankles, anything down the spine. All of those things can obviously be joint related type of issues and can obviously cause pain. Weaker joints, so a weak joint again could be something like luxating patella, where the joint hasn't quite formed properly, so that causes a weakness there, as opposed to having an actual accident or injury that causes a problem with a joint. Following illness, so some illnesses can make dogs really, really unwell. If a dog has, as I know I've got some people here that are, someone else, iPad is coming in. Whoever iPad is. Hello, iPad. So if you are just joining us, this is being filmed, so you just ask me at the end for a link to the recording, so you won't have missed the start of this. And thank you for joining us. If you haven't met me before, I'm Jo, and I'm going to be taking you through this talk. So illness, there are some illnesses that actually can be really, really painful for dogs. So things involving the stomach, things like pancreatitis, that can actually cause really, really bad pain. But dogs don't always show it. They're very, very stoic. Often they can be ill for weeks, months, and we don't know anything's there. Certainly dogs that end up with different types of cancers can have tumours growing, and we don't have a clue it's there because they don't show it, but actually there's a lot going underneath the surface. It can be a reaction to something, so if they've eaten something that's maybe poisonous, toxic, or just something that they've got sensitivity to, that can cause pain somewhere in the body. Things like that. Grooming is actually quite a big one, and it's one of the reasons why a lot of the groomers were able to stay open throughout some of the lockdowns we've had in the last year as a matter of welfare. Let me just hear a funny noise in the background. It was Echo playing with a plastic bag, because we're all about safety in this house. Let me move that before the duck suffocates herself. So that's why groomers could stay open, a lot of them, because it came down to welfare of the animal. That being that some dogs can get matted very easily. Some dogs are matted underneath the layer of coat. And so what can happen is it can actually then start pulling the skin and be really, really, really painful for a dog. They won't look like they're in pain, but actually their whole body is being pulled really tight. It might be the nails need doing. And if you're not sure about a dog's nails and you don't realise they need trimming, they can actually grow so long to the point that rather than your dog's paw being normal, the nails get longer and longer and longer, and it actually changes how your dog holds their foot, which in turn changes how they hold their legs, their shoulders, their hips, and actually can affect the whole body. So again, they can actually be in pain, but they don't show it because they're still doing the stuff that they love. It's just there all the time. Infections can cause pain. So if your dog ever has an ear infection, chances are they're not going to want you touching that ear. It might be that they're shaking it a lot, things are going on. It might not look like it's pain, but there's definitely something going on inside there. So, pain can actually come from so many different things, and it's not always really obvious that this particular thing's happened to our dog, and it actually can equal pain at the same time. It can actually be very, very, very well hidden. Generally, there are two kinds of pain that we're looking at. We've got the pain itself. So, for example, when a dog has had an accident, so they've actually managed to do something daft, they're chasing after a ball at full pelt, and they end up tearing the joint as they're turning, and they've now got a cranial cruciate ligament injury. So you've got the actual injury itself, or the illness, or whatever the problem is, and then you have a secondary type of pain that can start later on, and that's where a dog is overcompensating. So if they have pulled their CCL, and they're then obviously not going to put weight on it, they're not going to want to use that leg or that side of the body, so then they might well be putting more weight on the front, certainly diagonally. So if they've hurt their rear right, then they'll put more weight on the front left, and gradually what will happen is that side will then start becoming more painful because they're putting a lot more pressure on there than they should be. It could be that they're literally standing like this a little bit more, rather than using that side of the body to turn, they turn the other way more, so you've got more repetitive strain. So you end up then with a dog that's got main pain in one area that we might know about, we might not, and then they've got secondary pain somewhere else coming through where they're overcompensating. But again, because they've got it all the time, they don't know there's a problem there. Oh. Thank you for that, whoever that was. So again, if anyone wants to write a question, if anyone wants to ask a question but doesn't want to have their video or microphone on, do feel free to write in the chat box, and I will answer questions either as we're going, if it's literally linked to what we're talking about, or I'll answer it when we get to a good spot. If you can hear a weird noise, it is my duck in the background. You haven't got any problem with your computers. So yeah, so there you've got the two different types of pain. So I mean, it's not even just a case of there is pain, there is so many different branches from it. Dogs can have pain not only from injury and illness and things like that, they can actually be born obviously with issues that can cause pain as well. So they might actually have it from birth, they don't know any different, and that's just how they live their life. They have no idea that this is something unusual. Let me just have a quick sip of my extremely healthy drink. Okay. Oh. So, understanding pain. So, we generally have pain that is either acute or chronic. Okay, now acute pain is your short-term pain. It's the pain that kind of protects dogs or protects us from causing further problems. So it could be if your dog has cut themselves on something, they'll feel pain straight away, and they'll be reacting to the fact that something's not quite right. If they break a leg, if they strain something, so something that happens that's short-term, it will mend. It's not something that's going to be there forever. What signs might I see for CHF? Because apart from the obvious panting, my beautiful golden lab doesn't give anything away. Thank you for that, Tracy. I have got a whole section on looking for signs of pain and what they might be getting. So I will, if I don't come back to that, if I don't mention that, just give me a nudge in a short while, okay, and I'll cover that a bit more properly, rather than giving a very quick answer. But thank you for that. So the acute side of things is where something's happened, it's short term, it's not going to be happening all the time and forever, and so generally we get a bigger response. So they've hurt something, they've then got their paw up, or they're sitting funny, or they're, oh, that hurts, and they're making a noise, and that protects us. It stops us from doing further injury or damage to ourselves. The other type of pain is chronic pain. And chronic pain is the long-term stuff. This is where you have a dog that's got hip dysplasia, diagnosed at 4 years old. That's going to be there for the rest of their life. That's going to be chronic pain. It could be, again, stomach issues. If they've got something like IBS going on, they may well have discomfort there most of the time. So chronic pain is the sort of thing that they're going to have long term. It's always there, gradually might be getting worse. They might have days where it's worse than other days, and you'll notice that. But for the most part, it's there, and we don't always realise that it's there, basically. So I can give you a really good personal experience of this to give you an example. I have ME. Okay, now ME, really briefly, is a really lovely combination. Oh, really lovely combination. I'm assuming people are talking to their dogs. I keep hearing these lovely noises every now and then. Oh, which is pain and fatigue. All right. So it is chronic. It's something that you have constantly, and you just sometimes have worse days than others. And it's the worst days that people will notice something's wrong, and the normal days where people won't realise anything's wrong at all. So, for example, at this moment in time, I do have a morphine patch on. I do take different medications to help manage my pain and my fatigue as well. But I'm sitting here with back pain, lumbar spine. I have got pain in both my ankles. I have got pain for some reason in one finger, randomly. That's the fibromyalgia for you, that part. And I've got a splitting headache going across here. That's a normal day. That's a normal day for me, okay? So that's my chronic pain. That's the stuff I have day in, day out. But you might not have realised that I had any pain at all, okay?
No, you don't look like you have.
Exactly. However, if then I stood up and banged my leg, I'd probably go, ah! And then I'd be sitting here rubbing my leg for a moment, and that's acute pain, okay? That's the difference between the two. So imagine your dog has got chronic pain, slip disc, weakness in their elbow, they've got something going on with like I say, their stomach or something else going on somewhere else, and they've had that pain for a long period of time. You might not know it's there. You really might not realise it. It doesn't always stop them from doing the stuff they like. So my pain doesn't stop me from being spoken to by a duck. It doesn't stop me walking my dogs. Sometimes it does, but I do try and get out as much as I can. It doesn't stop me working for the majority of the time, because I can plan around it and I know what can help me. I can overcompensate. So my lower back actually has fusion in there, so it doesn't actually bend properly. So if I have to bend forward and then stand up again, so if I'm picking something up in a class, I know how to adjust my back as I'm doing that so it doesn't lock. So you wouldn't know there was a problem there. But when my physio sees it, he can see what the problem actually is, and he can see that there's not movement there. So we're really good. Any person or dog with chronic pain, we're really good at hiding it. So they do still do the stuff they like, and something that you might hear from someone, because I mean sometimes I'll see people for actual fitness for their dogs, and sometimes it's just in a class, you know, could be tricks, could be obedience, whatever it might be. And if I mention that actually I think their dog might be a little bit uncomfortable, but that's because I'm looking at it from my kind of experiences as opposed to just a pet owner, and so people might look and go, I don't think so. No, I think they're absolutely fine. You know, I'm sure they wouldn't do that if it hurt them. They wouldn't still chase their ball. They wouldn't still want to do agility. They wouldn't still jump up at people if it hurt them. Well, actually they would. They don't always link the two. The chronic pain, because they're so used to it, well, it's there anyway, I might as well just do the things I like, because it doesn't really make a lot of difference. And often if it's something they really, really enjoy and they get excited about it, that adrenaline goes really nice and high, and it actually covers some of that pain for the time being as well. And by the time that adrenaline goes down, oh hello, we've got more people coming in. By the time that adrenaline comes back down again, they won't associate the pain they're in with what they were doing. I thought I was going to get a question. So if you are just joining us, welcome. Thank you for being here. Everything that's being covered at the moment is being recorded, so there will be a recording at the end. And if you want to ask a question, you can either literally ask it, or you can use the chat box to write if you don't want to actually talk. Okay, so if you are joining us, welcome to our talk. So I'm just talking about chronic pain as opposed to acute pain. So chronic pain examples could be weak joints. So for example, Merlin probably has discomfort some of the time. The minute he looks really sorry for himself. Oh dear. Let me see if I can just tilt this slightly. Not as easy with the laptop. There's Merlin.
Oh, Merlin.
And this is the result. That's how I feel. This is the result of 5 days howling and wanting to get to his Ripley in season. There you go. How do you tire out a dog? Find a female in season for him. And that's with him not getting to her as well. So yeah, so it can be weak joints. It can be a problem that happens actually from birth. It can be genetic as well. So luxated patella actually can be genetic, not always, but sometimes, as can a lot of other problems as well. or it can be from injury. So a dog can actually be born with an issue that causes pain, and they won't know any different. So they just live with it, which is quite sad. But at the same time, they don't show it, we can't help them unless we can look for certain signs. One of the things that actually can happen from any age and is classed as chronic pain is osteoarthritis. Okay, so one of the things I am going to talk about shortly is a little bit on this, because it's something that's not always thought about or considered until dogs are much, much older, and actually it can be prevented when we do things from earlier on, and it can actually start much, much earlier than we realise sometimes, because again, dogs are so good at hiding it. So it's something we're going to come back to. Pain is complex. Pain is a really complex thing. Pain isn't just, I've hurt myself here and that's where the pain is. Pain obviously starts in the brain because that's giving you all the signals, and it actually can affect the joints, it can affect the tendons, it can affect the fascia. There's so many areas. Oh, got someone else. Gosh, by the time we get to the end of this, we're going to have millions of people. So it can affect so many different types of areas as well, which is why it makes it so hard sometimes to find pain relief for our dogs and for us. It's a real difficult one, to be fair. When dogs have chronic pain, when they have long-term pain, often the way they show it will be visually. So it'll be things they're doing that will just give a slight hint that there could be pain, as opposed to verbally. Okay. If we were thinking about whether our dog's in pain or not, and we're looking for something, we might be expecting them to do something like whining or barking, so vocalization. We might expect them, if they've hurt their leg, to hold their paw up. We might expect that they don't want to play games anymore, they don't want to play with the other dogs that live in the house, or don't want to chase a ball. We might expect that maybe if they've hurt their back ends, that they can't sit, or they're limping suddenly. So when we think of pain in animals, especially our dogs, we think of the real obvious stuff. And often by the time we see those things, actually they've already had pain for a period of time, but the signs are really, really, really subtle, because they're not doing those signs to show us, they're doing those signs to try and help themselves out. So getting on to what Jackie was asking about what signs she might see, panting. Panting is actually a real big one about pain. Obviously, if it's a boiling hot day and your dog has just had a walk, chances are they're going to be panting. It doesn't mean they're in pain. It just means they're trying to cool themselves down. But if your dog has done exercise, had a game, if they've had trouble getting out of bed, perhaps they took a while getting up, if they are suddenly shying away from being touched and they're panting a lot, then there's a possibility that that's an indication of pain, because when they pant, it kind of helps with the signals and the blockers and things that are going on with the brain, and it's a way that they try and help themselves to calm back down again. So excessive panting, when you think, okay, it's not even hot, why is my dog panting, actually can be a sign of pain. It can be a sign of stress as well, and of course if you're in pain for a long time, you're probably going to be reasonably stressed as well, generally speaking. So thank you Tracy. Licking a paw is a funny one. Now obviously I'm in quite a few different Facebook groups to do with dogs, and near enough every day someone will post and say, my dog, various breeds, is licking their paws. They've been licking their paws for the last 4 months. I've been to the vets and they've just said it's probably allergies. So I've tried bathing their feet in this, and I've tried giving them this medication. And then millions of people will say, well, have you tried doing this and doing that and rub this on there and try doing that? Licking a paw can actually be a sign of pain. Not necessarily, I keep talking to my own picture rather than the camera. Technology is far too advanced for me. It might be they're licking the paw here because they can have something called transferred pain. So it might not be that the paw's hurting, because of course if we think pain, we might think, oh, maybe there's something in the pads, need to have a little look, maybe the claw's broken somewhere. So we try and have a look at the foot, nothing's going on, so we think, okay, maybe it is that it's an allergy of some sort, and we dismiss pain. Actually, if they're licking their paw, there could be pain. You just moved my laptop. There could be pain in the wrist, could go through up to the elbow. They could have pain in the shoulder, through to the scapula, through to the neck, through to the cervical spine, even down to the thoracic spine. They could have pain.
That's really interesting.
into those places. And what it is you get transferred pain, so they're not really sure where it comes from, so they lick their paw. And also they can't reach these areas, they can't get there to have a nibble or do something with it, so they go to the nearest thing and they nibble their paw, and while they're doing that, it sends a little bit of relief through to the brain, and that alleviates it very, very slightly. So it doesn't mean if your dog nibbles their paw in a second, it's because they've suddenly got a broken leg. It just might mean if you're seeing it a lot and you can't seem to find a cause for it, look at whether there could be a possibility of pain. Look at other things around it, okay? It might be that, so nibbling is another thing. So nibbling paws, but nibbling other parts of the body. So again, a little example from Merlin. If we, on the rare occasion I actually have a holiday, we take our dogs out for a few days in a row, and we maybe have longer walks, and we take them maybe up and down hills and over beaches and all sorts of different terrains, chances are that's going to affect Merlin's knees somewhat. Oh, I'm being told I'm running out of time.
Oh, no.
I don't know why that is. That's what it's just told me. Oh, I can upgrade though. Let's have a look and see what that does, shall we? I might just end up having to do this as two separate bloody things like I did before. No, it won't let me upgrade. God knows what it's doing now. Oh, hello. We're loading all sorts of stuff. Let's see what it does. So what it might be that if your dog maybe has got, so Merlin with his knees, if his knees are sore, I will probably find that he'll just be nibbling them a little bit. So he'll be laying down, he won't necessarily hold the leg out, he won't be making any noise, he won't do anything different to normal, he'll still eat all his food as normal, he'll still play with Ripley as normal, but actually once he's laying down and thinking about it, he might well then just bring his knee up and have a little bit of a nibble, and that will tell me, okay, he's a little bit sore on those knees, so I'll just watch what he's doing for the next day or two. It could be that they're sleeping more. And I can tell you from experience that being in pain all the time is exhausting. It really is tiring. It's on your mind all the time. It's just always there. Sometimes you can find something that alleviates it for a moment and then it comes rushing back again, but it's exhausting. So it could be that your dog is sleeping more, and it doesn't mean they're getting old. It just might mean that they're experiencing pain or discomfort. It hasn't got to always be pain. It might be their posture. So it might be that suddenly they're standing with a bit of a roached back, and a roached back doesn't necessarily mean they've got a back problem. It might be they've got a problem in the hip, in the shoulder, could be in the neck, and actually they're roaching their back to just shift the weight differently so that they can alleviate some of that pain, okay? Tucking the tail under more, so posture again, if the tail's tucked under more, if the pelvis or the hips are tucked under a bit more, maybe the back legs are under the body more than they used to be. They used to have a nice stand and the back legs would be out a little bit, and now they're tucked under. Again, it could be a sign there's some pain going on somewhere. It could be the stomach, it could be the back, it could be the hips. It might just be they're trying to adjust where the weight balance is, and actually it's the front end that's hurting and they're trying to put more weight on the back. Dogs primarily are pretty much 70-30 in their weight distribution. So that just means that 70% of their weight they have in the front, 30% in the back. Sometimes it's 40-80, 120% pressure. But most of the time it's 70-30. So if they've got an issue with the front end, then they're going to try and compensate and put more in the back. You might find the opposite. You might find they're putting more weight on the front end. So I see a Pastel Terrier called Cooper. I've seen for a few years now for Canine Fitness. We knew before he was adopted that he had a replacement hip problem, and literally when he came home to his mum, I had a look at him, and the back legs had so little muscle. It was crazy for a dog that was, I think he was 4. All the weight was in the front. The front was like Popeye and the back end was like a little skinny suit model or something. And it's where he was compensating. He was putting everything in the front, so the neck was tight, everything in the front was achy, and the back end, the back end was painful to try and use it. So if he sat, he'd have to maneuver himself, and his legs would be sticking out at funny angles. He couldn't go upstairs. He didn't have the strength to push himself up the stairs. He'd hitch his leg, where you actually see one leg shorter than the other, where they had to use tendons to hold the hip properly. But we've built him up. We've done lots of fitness work with him gradually. The muscles now are level. There's a muscle there. He can stand straight rather than, you could see him leaning forward. He literally could walk pretty much doing a handstand. And it's just where he's trying to avoid pain, so he's just using something else, but because then that puts more pressure somewhere else. Elbows turned outwards. So if your dog's normally standing, you can't really see that from that angle. If they normally would stand like this, and then suddenly you notice that the elbows are turning out, then that can be a sign that they're, again, compensating for something. Lip licking, yawning, things like that all go towards, time with the panting from that Tracy mentioned, that are signs that there's something going on, there's pain. Pain can be causing stress, and so they're trying to alleviate it somehow. They're not always sure how. Shying away from being handled or touched or stroked. So if your dog normally is quite happy for you to give them a fuss here, and you go to fuss them and they just move, they move away, they paw you, they might give a little bit of vocalization. Could be they've got a bit of pain in their ear. It could be they've got pain, teeth, dental pain. It could be somewhere else in the jaw area. It could be in the neck area. And they're actually just trying to stop anything happening in that whole area because they know it's going to hurt them. It could be that normally your dog can sit really straight. And suddenly when they go to sit, they take a little bit longer to do it, or they poke the knees out when they do it, or they poke the feet out when they do it, or instead of sitting completely flat, they're sitting as a crouch and, the bum's off the floor, things like that. So there's so many different things that can show that a dog is in pain, whether it be suddenly or long term. So it's just knowing your dog. And if you do see a change, behaviour change, a change in what they're doing, a change in how they're walking, what their activities are like, just have a little look and think, were they always doing that? Look, oh, hello, we've got people coming in. Were they always doing that? Maybe they were, maybe they weren't. Oh, hello. I think he's trying to tell me. Could nibbling paw relate to conjunctivitis? Ashley was licking her paw last week and was diagnosed with conjunctivitis on Thursday. Potentially. I'm just thinking the conjunctivitis, if it's causing discomfort and if it's causing pain, then yeah, the pain there could certainly be transferred down that side of the body, and then go to licking lips. You'd probably find that there'd be either some moving the face around the floor or on furniture or on your trouser legs and things like that. It could be that where she's had the conjunctivitis and has then been trying to alleviate it, that actually she's just caused a little bit of overusage somewhere, and then that's why she's licking the paw, because where she's been doing that a lot, now she's actually got not doing that. Imagine if dogs could do that. She's actually then put a bit more pressure perhaps somewhere else. For that one. So the biggest cause of pain in dogs. What is the biggest cause of pain in dogs of any age? It is osteoarthritis. Okay, of any age. To give you an idea, take all the dogs in the UK from age 1 day through to however many teen age. Over 20% of all dogs have got canine arthritis. All dogs, not dogs over 8, all dogs. Okay.
Wow.
Yeah, that's a lot. It can happen to dogs of any age. It can come from so many different causes, and because we think of it as an older dog issue, so if dogs have joint problems or they look like they're not quite as strong as they were, we kind of think, okay, it can't be arthritis because they're only 3. It can be. I actually know dogs personally that have had arthritis diagnosed at the age of 6 months. 6 months, not years, months.
Wow.
So it can happen. I am literally going to run out of time in 2 minutes. So what I'm going to do is quickly do another Zoom and stick it on the event page where the other one was, because I'm not sure why it's only given me, I presume it's the amount of people. Because when I do this with my family, we have more than this and we can do bloody hours. Trust me, they go on forever, they do. So when it cuts out, I'll get another quick Zoom and put it on. Yeah, so that's the dogs that are diagnosed. There's even more dogs that won't have been diagnosed yet as well. which means that they are living in some sort of pain and discomfort, and they're not showing it, and so therefore no one knows. And even if they've gone to the vet for something else, the vet might not see it either, because they're not there to look at that. They're looking at something completely different. So it's actually a real big one. So that's one of the reasons why I wanted to give some ways of preventing and identifying these things, because if we can see that our dogs are uncomfortable when they're younger, we can actually prevent arthritis even happening for a lot of dogs, or certainly happening when they're much, much older. So rather than having signs when they're 5 years old, they might be 12 or 13 by the time they start having signs. And actually that can make quite a big difference. When Gypsy's in pain, she cannot squat for a poo, but she walks along. Yeah, absolutely. So that means that she'll have pain in the hips, in the lower back. Perhaps she might have pain in her knees. It could be it might not even be joints. It could be in oh God, I can't think of the blooming word now. Muscles, and it could be in all sorts of different places for that. But yeah, we see dogs that are doing handstands. We see them, like you say, that can't poo properly, or they put their leg up when they toilet, perhaps, and that's because they're just trying to compensate for things. So yeah, it's pain's a really, really weird thing. It's going to cut out. I want to talk about something, but I don't want to start and it cuts out. So I'm just trying to fill this last few seconds, because it says less than a minute. So it's going to cut out at any moment. So what I'm going to do is stop the recording here. Recording for this great big actualization. So yes, thank you for rejoining. People that don't rejoin, I will send the recording out to them whether they want it or not. So yes, so osteoarthritis. What's the matter, Merlin? Stop whinging, please. It's something that this is something that's not easy for people to hear, or not easy for people to talk about. But canine arthritis is literally, and if you look this up on Google, you will see the same. Thank you, man. That's very helpful. Yawning there is literally the one of the main leading causes of euthanasia in dogs. Okay, purely because they are in so much pain that they literally have no quality of life. And again, that's not because the dog is 18 and a half and can't walk and doesn't want to eat and is laying in their bed all day and can't stand up to toilet or anything like that. That can be a dog that's 2 years old and is just in so much pain that they just haven't got quality of life anymore. So so canine arthritis, osteoarthritis can actually affect dogs in such a way that it is one of the leading causes of euthanasia in dogs, which is quite shocking, really. So what can we do? What can we do? Oh, Merlin, come up here. Come on, there you go. Shouty dog. Get your bottom out the way. So we can do quite a lot of things to prevent things like this, joint problems, arthritis problems, things like that. Just keeping an eye on whether people are still coming through. From when dogs are really young. So if you've got a puppy, if you've got a teenage dog, if you've got an adult, if you've got a senior, these are all things that we can put into place to help prevent issues that might happen in a few months, that might happen in many years, that might never happen because we've done a good job preventing it. All right. So one of the things that I see so often, people send me videos of their dogs doing stuff. They send me pictures. I see stuff on TV. I see stuff. Duck a bloody treat then. I see stuff on Facebook and stuff like that. And that is slippery floors. All right. So a slippery floor. I actually had a conversation online with someone the other day who didn't know what I meant by slippery floor. She was saying that her dog won't go up the stairs suddenly, but is quite happy to jump on the sofa still. The dog's 13. Someone mentioned pain, and she said, no, the dog can't be in pain because he still jumps on the sofa and it still plays a ball. So I said, asked if the... Well, you'll have to wait. I asked if the dog, if the stairs were slippery at all, and she just literally wrote back and said they're carpeted. That was her reply after I wrote a long message. Carpeted. I said, well, is the carpet non-slip is what I'm getting at. So she said, actually, yeah, it is quite slippery. Okay, well that could be why then the dog's still jumping on the sofa because it's one jump and the floor there might be sturdy, and then stairs, if they're slippery, lots and lots and lots in succession, then of course it's harder for her if she has got issues. So slippery floors. Slippery floors aren't always obvious, as you just heard. If you've got a puppy, for example, and they're sleeping on their bed and they wake up and go to get up and have a good stretch and they get off onto a really slippery wooden floor, they're automatically, even at months and months old, having to overcompensate for that. They're having to try and utilise the muscles and the ligaments and
everything. I say don't play with her on the kitchen floor.
If they are playing with a toy and it's a slippery floor, so it could be wooden, it might be that they're playing on a slippery floor that's outside and it's just decking and it's wet, so it's a little bit slippery, but normally it's not. Things like that can all mean that they are having to overcompensate, and even at a young age there is too much stress happening on the body. You're going to have to just wait a minute, aren't you? So that's going to then be causing problems. Merlin wants to go to the loo. That's what he's telling me at the moment, which is really not very helpful, is it? Can you just wait 10 minutes? Echo's eating a poo bag. That's brilliant. So two things to consider for joint issues, pain issues for dogs, is you can have a weakened joint or a weakened part of the body for a dog, and a normal action is going to cause problems. Or you could have a dog that's got a perfectly good body, everything works great, there's no joint issues, there's no weaknesses anywhere, but if they're doing abnormal actions repetitively, then that also can cause problems. Okay, so consider a young puppy that's got no problems whatsoever, and actually they're slipping on the floor, they're going up and down stairs, you know, they're doing all these things several times a day, every day for that first year of their life, and that's likely to lead to issues very early on. You might have a teenage dog that has got a weakness in their lower back. They've got stomach problems, so they stand differently. That, of course, will affect their posture. That will, of course, affect the joints and other things everywhere else. Stop shouting. Honestly, you'd have a dog and a duck. Good boy. If then they are just doing what would normally be quite an easy thing for them to do, so it could just be that they are going in and out of the back door several times a day, and there are a couple of concrete steps out there. So it doesn't seem that bad, only a couple of steps. The dog does it. The dog's quite happy to do it, to go in and out the garden, but they've already got a compromised area of the body somewhere, and so that isn't really helping. It might seem really easy and really God, what's the word I want, Merlin? Told you, I get distracted when Merlin's doing stuff. Really non-threatening to the dog, but actually it can cause problems because they've already got compromised part of the body. And so just something that looks quite everyday and normal can cause a lot of problems. So slippery floors, put rugs down, put mats down. Don't have slippery floors if you've got dogs. You know, a lot of people really, really don't want to have to put a mat down if they've got really lovely laminate flooring. But, you know, maybe just put one down where your dog's playing, or put it down where the bed is, perhaps. That would help. Make sure that your stairs aren't slippery. Can you restrict access to the stairs so they're not up and down, up and down, up and down all the time? So baby gates, teach them not to go up there in the first place. Things like that can obviously be really handy. It could be that you're supporting your dog going up and down the stairs. So I live in a bungalow, so I don't have that problem, which is good. But when I when I did something with Merlin a couple of years ago that happened to include the London Palladium, which will stay unnamed, there were so many stairs in that place, so many stairs, and some of them are easy to go up and down, some of them are quite tall steps. So we were there for 13 hours on the first day that we were doing stuff there, and I really wasn't happy with Merlin having to keep doing that. So although he's not landing on his back legs, although it was all pushing, it was constant. I mean, I can't even say how many times he went up flights of stairs there in a day. So by the last couple of hours, I was picking him up and carrying him up. If I had a bigger dog, I'd be using a harness of some sort just to take the strain off. Quite a normal thing. My dog can go upstairs. What's the problem? But that was really repetitive. That was a crazy amount of stairs for what was a 7.5-year-old dog at the time. Yes, I know. Repetitive actions. So things like throwing. It's so bad. Throwing a ball catches, things like that. They're repetitive actions. Jumping on and off the sofa, that's repetitive action. Things like where dogs jump up on their back legs, and they, Merlin does a little wavy thing, which is quite cute, but I don't encourage it. Jumping up on their back legs and jumping up and down. You see that a lot in so many small breeds, and I see it, and I can almost feel the pain the dog is in. Thank you for that. Sorry, it's the hen, the recuperation hen is now having a dust bath in the background, if you hear scratching. We can be looking at the types of exercise and levels of exercise that our dog has. So they might like going for really, really, really long hikes, but if they've had a lot of different exercise, maybe they've suddenly gone out and met with a dog they don't normally play with, and their play has been really different. They've been running, they've been rolling around, they've been jumping on each other and all having a lovely time. Consider then the next couple of days they might need a much shorter walk or an easier walk, so not walking on gravel or sand, things like that, because that's going to take it out of the dog. Look at when they're going to the vet, or you might not have a vet check booked, but you've seen that actually, maybe your dog is sitting a bit differently, unusually. They are licking a foot they don't normally lick. You can't touch a certain part of the body that you normally could. Let the vet know and actually say, could you have a look? I just want to check that there isn't any pain going on. Because the first thing that obviously vets will do is go through their teaching. They'll go through what they're trained to do, as they should. So if it's an ear issue, Cassie, poor Cassie, bless her heart, she went 2 years, she went from age 14 and a half to 16 and a half, which is when we lost her, and actually had nerve ending pain in her ear, causing her pain, causing her ear to be at this angle all the time, which then put off her balance, which then meant that she had spondylosis in her lower back because she was off balance. And every vet we saw said, it's an ear infection. It's an ear infection. Let's give you more stuff for an ear infection. Brilliant. There was no inflammation. There was no smell. There was no discharge. There was no actual sign of an infection happening, other than clearly her ear was painful. I literally I couldn't even have a collar on her because the collar actually was affecting the ear somewhat. If she went to itch, she'd cry out in pain. But all you could tell was that you had a dog that could walk in circles really well, straight lines not so much, and that her ear was at half mast. That's the only clue that you could tell. But finally we found a really good vet near London who had a look, listened to what I said, knew that she had history of epilepsy for most of her life, and diagnosed and looked into it, and actually diagnosed nerve pain. Again, I have nerve pain in one of my legs. I know what that's like. So it's not that I didn't trust my vet. It's not that I thought my vet did a bad job. They did what they thought was right. Nerve pain isn't going to be something they come across all the time, and it might not be something they cover very thoroughly in their training. And you've got to kind of rule out other things first. So Cassie had a hell of a lot of treatments for ear infections. I've probably still got some in the cupboard somewhere, but bless her, she was in all that pain for them 2 years while we were looking for an ear infection that didn't exist. So if you suspect something from your dog, let your vet know, let them know exactly what you've been seeing, exactly why you suspect it, and monitor it. Make a diary, take pictures of your dogs. I've got pictures of all my dogs that I take every 6 months, and maybe a little bit excessive for me because of what I do for a living, which are my dog standing, so I can see them side on from both sides, front on, rear on, and from above, so that I can see if their posture changes. I can see if suddenly there's a change in their muscle, in the way that their stance is. When I'm looking at them running on video, I'm checking to see if anything's changed there. I'm looking for so many different things. It's because I do that I saw that Merlin had an issue when he was a year, and that's why he doesn't have problems now. He doesn't need surgery. He doesn't need any things that most pet dogs would need. Certainly by age 9, probably much sooner. Bless him, he's chatting away. He's looking at me as he talks. I know, darling, I know, you're a good boy. But because I have ramps everywhere, even though I'm in a bungalow, my garden is raised. I haven't got one big ramp for stairs. That would be crazy, wouldn't it? I've got ramps going up to my raised garden. I don't let the dogs jump out the car as best as possible, but sometimes you're naughty. And I catch him mid-flight, so I'll pick him up. If I had bigger dogs, I'd probably use a ramp. So again, it's not a case of wait till they've got an injury and then go, okay, they're getting a bit old now, they struggle getting in and out the car, I'm going to pick them up. Do it now, you know, pop a ramp in now, use some stairs, help them up with a harness if need be. You're very chatty. This isn't even your annoying noise. You diverted in during the day. Blimey. So putting things in place now. Merlin doesn't do anything on a slippery floor at all. I even have I have bath mats, padded bath mats in my kitchen, so that when I'm doing their food, if they come in to sit with me or I'm doing something else in there, they actually have mats they can sit on that are non-slip. I use bath mats because they are naturally non-slip. That's the idea of them. And a lot of the time they're really padded and actually quite nice to stand on. So even when they're just standing on a slippery floor, I put something down for them so they're not slipping. They're not having to compensate for anything, just to try and avoid issues, really, avoid things from happening. Eventually, he might need something for his joints, but hopefully won't be for a while. And once dogs have a joint problem, they're going to be more disposed to things like arthritis, because again, you've got the compensation happening, you've got the wear and tear happening, you've got so many things that are going on with a compromised joint or a compromised part of the body, that the arthritis is more likely to happen. Certainly if you have a dog that's had to have surgery on joints, you suddenly increase the chance that they might then need help with arthritis before you might expect it. So again, if I'd let Merlin have the surgery that the vets expected him to need at age 3, if I hadn't done stuff to avoid that, then age 3 has surgery, you'd expect that maybe by the time he was 8 or 9, he'd definitely, by the age of 8 or 9, he'd be showing signs of arthritis. As it is, at 9, he's just gobby. And as you can see, there's nothing wrong with his back legs whatsoever, other than what we know about. And certainly no signs of anything hurting him. But I do keep his weight down. That's another thing we can do. I'll talk about in a sec. I do make sure that he's warmed up before he does exercise. I cool them down. You know, there's so many things that we can do. Weight management is a big one, whether it's arthritis or the heart that we're trying to protect, or the body in general. Keeping their weight good for their size, not just breed, but just for their size, makes a hell of a difference. And this such a high level of dogs that are overweight, and it's really hard sometimes to tell that a dog's overweight. When they're overweight, they're putting pressure on everything. A dog that's overweight for you know, a good couple of years of their life actually can shorten their life by over 25%. It's been known, it's been published, so it can make quite a difference. So if you've got a dog that potentially could be living to 16, which you might not get to at this rate, you've got a dog potentially could live to 16 and they've been overweight for a couple of years, actually you're going to lose that dog at nearly sort of 11 or 12 just because they're overweight, and that causes problems somewhere else. So you can check with vets as to what weight they feel your dog should be. I have people all the time saying, my dog went to the vets for a checkup or for their vaccinations or whatever it might be, and they said my dog was a bit overweight. What do you think? No, fatten them up more, it'll be fine. I'll always, you know, handle a dog, have a look at them, and I'll give my honest opinion, which normally is, yeah, you probably wouldn't let them put on any more weight, and they could probably do with losing a little bit. It's very rare that I completely disagree with the vet when it comes to weight management. You can tell if a dog's put weight on because often their body will change. So you're looking from above them, you're looking that you've got Merlin, shoulders down to the waist and then out to the hips again. So you're kind of looking at an hourglass kind of a shape. If I could let you go somewhere, I would. That kind of shape. If your dog is straight, they may be a square shaped dog. So a lot of, there are terriers, like Patterdale Terriers, for example, are very boxy. They should still have a waistline somewhere. But if they're straight down and they used to go in, then they've put on a little bit of weight somewhere. If the body goes shoulders, waist, hips, they are probably overweight. That's more than they should be. Okay, so you can tell from looking at a dog. If you've got a dog that's got a lot of hair like mine have, then let me just, my very well trained dog that's now on top of the sofa, you can literally do it by running your hands down the body and check, does it go in there and then back out again at the bum? Because if it does, then they're probably okay. If you can't tell because they've got so much fur. All right, you can tell by feeling them. So you can feel the ribs. So if you run, can't get the laptop right, you can start with the shoulders, sides of the arms, front legs, that's what they're called, and run your hands where the ribs should be. If you can literally slowly feel where each rib is, then that's pretty good going. If you run your hands over and you're thinking, yeah, I don't think my dog's got ribs, what have they got? Bubble wrap, what's going on? Then chances are they could do with losing a little bit. That's general. Obviously, without seeing a dog, it'd be hard to tell, but that's a general. If you can literally play your dog's ribs like a xylophone and you can get your hands behind it, then they might need a little bit of weight adding, but that would be something to discuss with a vet. But certainly you want to be able to feel a little bit of something going on there with the ribs. You might also be able to feel their spine. If you can feel a bit of the spine when you're palpating down the back, then that's a good sign. When they get really, really obese, you generally can't feel the spine whatsoever. But again, it differs from breed to breed. So sometimes you'll see a dog that looks really, really skinny and you can see their ribs and they're a short-coated breed and you think, oh my God, that dog's underweight. And actually that's how they're supposed to look. So it can be really hard sometimes to know if a dog should be on a diet, not on a diet, what can we do? But yeah, weight control is a really, really, really good way of keeping a dog healthy and preventing pain in the future, because the pain is going to be compensatory, it's going to be putting strain on the heart, it's going to be doing all sorts of things that Merlin's now looking for something to do that's naughty, I think. And so keeping that weight down is just a really, really easy way of not only helping prevent pain, stopping pain that's happening, but also ensuring a dog doesn't have their life reduced purely because they've had too much to eat. And of course we're in control of what our dogs eat at the end of the day. I mean, I'm feeding treats to Merlin as we speak just to stop him shouting because I can't ignore him because he'll keep shouting. Yeah, I know, he's telling me where Ripley is. So we are in control of what they eat, and it is hard for us, but there are ways of managing our dog's weight. So if you struggle, if you know someone that struggles, if you think, actually, I think they are putting it on, or actually, I'd rather try and work out how to prevent them putting weight on, then let me know at some point, and I will obviously help you with that. I've just realised I haven't got my chat screen open in case there's a chat. There isn't, that's fine. So yeah, so weight management, making sure that the surfaces aren't slippery, not having excessive repetitive actions all the time, you know. So, you know, obviously I teach agility, and so dogs are doing repetitive actions there, but they do their work, then they wait their turn. They do their work, they wait their turn. If they're competing, they're not competing all day long. They go out, they compete, they stop, they then walk around a little bit, they get to rest a bit, you know, so it's not repetitive. But if we had someone that perhaps has agility equipment at home and they really want their dog to do well, and their dog loves agility, so they think, okay, we're going to go out in the summer and several times a day we're going to do a load of practice. That's quite repetitive. That could be too much for the dog. If I'm trying to think what else there might be. If you've got a dog that is doing things on solid ground, so it might be you go jogging with your dog or cycling with them, and the path that you use is actually concrete, and they're running on a hard surface day in, day out for many, many years, that's going to most likely cause issues on the supportive joints, on the looking the shoulders, cervical spine, possibly down the hips, the knees, the elbows, even down to the toes, compared to a dog that's free running on grass. Yeah, so it's literally looking at what we can do to help prevent things from happening in the future. No, Merlin, you're doing very well. Merlin's starting to pant, which tells me that he wants the loo and he's possibly in pain. Are you in discomfort, darling? Why are you still eating treats if you want the loo, you Wally? So yeah, so that hopefully is giving you a few things to think about. obviously, if I talked about pain as thoroughly as covering everything we have, then this would be a talk that would take many, many days. Well, I just wanted to help people kind of understand the types of pain, why dogs carry on doing things while they're in pain, so it doesn't look like they are, why it can be so hard to diagnose it sometimes, whether it's us noticing or vets identifying it. He's now just whinging at Ripley, in case you can hear that, which you probably can, because she's locked away in a bedroom and he really wants to see her. Understanding how it can start, and that actually dogs of any age can have it. You know, it might be that sometimes your dog does something, or a previous dog has done something, and you thought, well, do you know what? If it weren't for the fact that they're a young dog, I'd swear that they've got something not quite right with them, with their joints, or, you know, do you know, they really remind me of you know, a family member that's got arthritis or something like that. But because it's seen as a young dog issue, we kind of rule it out. Oh my God, it's far too young. I remember going to have work physio. Honestly, my body just doesn't work. Having physio about 20 years ago on my shoulder. So I was 20 when I went to have it done. And the physio said to me, do you know what? He said, I'm going to have a little food. And I think actually there's a little bit of arthritis going on, part of your, I think I had elbow issues as well. There's a little bit of arthritis possibly coming through here. And I did sort of stop and look at him, and he said, no, everyone can have arthritis. It's just, we generally think of it as an older person thing, because by the time it's come through and we actually need medication or treatment or something to help it, it's because we've had it for so many years that we now can't do anything other than treat it. But it can happen to anyone of any age again. And again, I know people that are very young that have got arthritis problems in their teens. So if it can happen to us, it can happen to dogs as well. So yeah, you know, have a look, see if your dog is doing something unusual. Have a look at why that might be. It might not be its joint pain, it might not be arthritis, but it could be that something's going on somewhere, definitely. And remember, by the time you see the pain, chances are they have been in pain for some time. So, and it's a real hard one, actually. I've seen dogs before now where the owner has said, I've said, oh, you know, I think they might be a little bit uncomfortable, actually. Let's just adjust what we're doing. And they've said, oh, yeah, but yeah, well, they're only this age. They're only 8. Yeah, my other dog's still doing this and they're 14. But yes, but that dog might be all right. The dog that we're looking at is the one that we're showing pain with. You know, this, not comparing dogs, and well, that one's older, so that's the one that's going to get painful first. It can happen at any age. You know, my mum obviously is older than me, yet I don't think she expected to be able to still be doing step aerobics and trampoline bounce classes and things. And I literally struggle to do yoga because of my body. You know, it's not to do with age, it's individual. Merlin, thank you. So yeah, so lots of things to consider there. Hopefully that has been of interest to at least some of you, if not all of you. Hopefully that helps you to sort of have a look at your dogs or any of your pets really, and think, you know, what might be causing discomfort, what can we do to change things. If you've got any questions at all, feel free to either unmute yourself or pop something in the chat, and I will obviously do my best to answer that. The recording I will put onto YouTube, and then I will send you each the link. Thank you. The link for it. So if at any point you want to hear Merlin's voice, then you can. And you can then sort of listen to certain parts again if you want to listen to certain parts again. Thank you, very interesting. Thank you, Judy. And if you've got any questions after this, if you sort of think, oh, I really should have asked about that, ask me. You know, you can ask me. CHF, hidden pain signs. Again, it differs from dog to dog. It's looking at, thanks Ian, it's looking at what's different to normal. So you've got panting. Are there any other things that are happening that are different to normal? It might even be that you've got things that are being shown all the time, but they weren't there a few months ago, they weren't there maybe a year ago, but they're doing it all the time because they're either arousing discomfort, or they've got, sorry Merlin, or they've got discomfort. What I'm going to do, Tracy, is I'm going to send you some a message, a private message, just with a couple of extra things in there because it is quite specific, and also because I think Merlin's going to pee up something in a minute, bless him. So yeah, plus the vet said she has a tumour. Okay, I'm going into questions now. I'll ask you questions in a bit, but yeah, it'd be interesting to know where the vet said the tumour might well be, if it's all linked. My tailor had hemangiosarcoma. He had tumours, including a bloody great one in his stomach that no one knew was there, and he must have been in pain for months and months and months, and no one knew. And because he'd had a tumour appear on his shoulder that we knew anything about it. So any questions, let me know. Pop me a message through, or if it's something that you think might be useful for other people to hear, pop it in the event page, because that will still show even though it will move down. I know, Merlin. So thank you, Merlin. So thank you very much for putting up with me and Merlin's gob. Gob that was. Hopefully that gave you something to work with. And Tracy, thank you, Pauline. Tracy, I will PM you, so we're going to have a quick look at seeing if we can identify some other areas that we can see when she's in more pain or discomfort, and also see if we can alleviate it a little bit for you. All right, so thank you very much, everybody. Enjoy the rest of your weekend. I'm going to go and take a breath because I don't stop, and possibly have a drink and let Merlin go to the loo and relieve Ripley from her prison in the bedroom. So thank you very much, everyone. Take care of yourselves, and I will speak to you hopefully very, very soon. And I'll stop the recording now.